stop. If you're doing everything right, taking your medication on time, cutting carbs, checking your glucose religiously, and your blood sugar is still climbing, what I'm about to tell you will either devastate you or finally set you free. For 24 years as a cardiac surgeon, I've watched patients follow every protocol, eliminate sugar, count every carb, take every pill exactly as prescribed, and still watch their fasting glucose creep from 110 to 140 to 170 with no explanation from anyone. And here's what nobody is telling you. You're not failing. Your doctors aren't withholding information, but you're all fighting the wrong battle. Right now, at this exact moment, there's a 90% chance your cells are rejecting insulin, not because of what you ate last night, but because of something so fundamental, so absurdly obvious, that it's been hiding in plain sight for decades. The medical system won't prioritize this because there's no prescription for it, no procedure, no billable code, no pharmaceutical patent. But I've watched it drop fasting glucose by 40 to 50 points in 2 weeks without changing a single meal or adding a single medication. I'm Dr. Rebecca Monroe. 24 years of cardiac and metabolic medicine. And what I'm about to show you isn't experimental. It's not fringe science. It's basic human physiology that's been deliberately ignored because it doesn't generate quarterly profits. This is the variable that determines whether insulin can do its job before food or medication ever enters the equation. And if you've been told your only option is more restriction, higher doses, or eventual insulin dependency, that narrative ends today. Here's what's actually happening inside your body right now. The problem isn't what you're eating. It's whether your cells can physically accept glucose in the first place. Blood sugar doesn't rise only because glucose enters your bloodstream. It rises when glucose can't get into cells. And one of the fastest ways insulin stops working properly is something medical schools barely mention in diabetes care: cellular dehydration. Same meals, same medications, completely different biological response depending on hydration status. That distinction changes everything. Let me be clear. This is not about replacing your treatment. It's about restoring the internal environment your treatment depends on to work. By the end of this video, you'll understand why fasting glucose becomes wildly unpredictable after 60, even when nothing in your routine has changed. How hydration timing affects insulin sensitivity more than hydration volume. Why ice-cold water can actually worsen morning blood sugar readings. And how a simple hydration structure can stabilize glucose without adding a single restriction to your life. This is realistic. This is physiology-based. And you can start today, not next Monday, not after your next doctor's appointment today. Now, before we go further, I need to say something. If you've been managing diabetes for years, you know the guilt. Every high reading feels like personal failure. Every medication increase feels like proof you're not trying hard enough. The advice keeps getting more restrictive, eat less, move more, be perfect, and you're exhausted. But here's the truth most doctors won't say out loud. You can't discipline your way out of cellular dehydration. You can't willpower your way to better insulin sensitivity if the foundation isn't there. Your body wants to regulate blood sugar. It wants insulin to work, but it can't do that in a dehydrated state. It's like asking a car to run without oil. The fuel is there. The engine is there. But the system physically cannot function. Add the oil, and everything works. That's what structured hydration is. It's the oil in the metabolic system. And once it's there, everything else you're already doing, the diet, the medication, the exercise, all of it works better. Not because you changed those things, but because the environment changed. Your cells can finally respond. I've seen 7 2-year-old patients drop fasting glucose from 180 to 130 inches. 2 weeks, with 0 diet changes. I've seen A1C levels fall by a full point in 90 days without adjusting medication. I've watched people who thought they were broken discover they were just dehydrated. And I'm going to walk you through exactly how this works, step by step, so you can implement it starting tomorrow morning. But first, I need you to do something. If this kind of calm, science-based guidance matters to you. If you're tired of fear-based advice and quick fixes that don't work, subscribe to this channel. I read every comment. And if what I'm about to share resonates as we go, just type approved and I'll know this helped. Because here's the thing, you deserve to know this. You've earned the right to understand what's actually happening in your body. And you shouldn't have to wait for your doctor's office to catch up with research that's been published for years. Let's get into what's really happening and why hydration after 60 matters more than almost anyone has explained to you. Most adults over 65 are chronically dehydrated even if they don't feel thirsty. That's not an exaggeration, it's measurable. And dehydration makes blood sugar control unnecessarily difficult, regardless of diet or medication. Yet, hydration timing is rarely discussed in diabetes care. It's treated as optional, as general wellness advice. But it's not optional, it's foundational. As we age, 4 things change that make hydration harder, and almost no one explains this to patients. First, cellular water channels called aquaporins become less responsive. These are the gatekeepers that let water into cells. When they slow down, cells can't hydrate efficiently, even when you drink. Second, kidney filtration efficiency declines. Your kidneys can't conserve water the way they used to. You're losing water faster than you realize. Third, thirst signals weaken and delay. By the time you feel thirsty after 60, you're already significantly dehydrated. And fourth, common blood pressure and diabetes medications pull water from the body as part of their mechanism. Diuretics, metformin, ACE inhibitors. They're doing their job, but they're also dehydrating you in the process. You can be profoundly dehydrated without knowing it. No dry mouth, no obvious signs, just rising blood sugar that no one connects to hydration. Here's why that matters so much. Even mild dehydration makes cell membranes more rigid. Rigid cells resist insulin. Glucose stays in the bloodstream not because you ate wrong, but because your cells physically can't accept it. Insulin is like a key. But if the lock is stiff, rusted, seized up, the key doesn't work. That's why your numbers rise despite doing everything right. The food isn't the problem. The medication isn't failing. The environment inside your body has changed. And once you understand that, everything else starts to make sense. Let me give you a real example. Mark, 72, retired engineer. Mark's fasting glucose had been stable for years, consistently in the 120s. Then, suddenly, over the course of 3 months, it climbed into the 180s. No diet changes, no missed medication, no explanation from his doctor beyond age and disease progression. When we looked closely, he was drinking fewer than 2 glasses of plain water per day. Everything else was coffee, which is a diuretic, or juice, which spikes blood sugar. We adjusted hydration, timing, and temperature only. Didn't change his food, didn't adjust his medication. Within 2 weeks, his morning readings dropped into the low 130s and stayed there. Same food, same meds, different hydration strategy. That's the power of addressing the right variable. Now, here's the core insight I want you to hold on to. Blood sugar instability after 60 is often a volume problem, not a food problem. When cells are hydrated, insulin works. When they're not, nothing else matters. You can eat perfectly. You can take your medication exactly as prescribed. But if your cells are dehydrated, glucose has nowhere to go. It's like trying to pour water into a bottle with the cap still on. The water isn't the problem. The bottle is sealed. And yet, most treatment plans focus exclusively on what you're pouring, never addressing whether the bottle can actually open. Let me show you the 3 most common hydration mistakes people make after 60. Mistakes that quietly worsen glucose control every single day. First, counting coffee, tea, or juice as water. These fluids have metabolic effects on the body. Coffee is a diuretic. It pulls water out. Juice spikes blood sugar. Tea can be fine, but it's not the same as plain water for cellular hydration. Your cells need water, not flavored liquid. Second, drinking ice-cold water, especially in the morning. Cold water causes vasoconstriction, your blood vessels tighten. That reduces circulation to cells and slows glucose uptake. Room temperature or slightly warm water improves absorption significantly. And third, drinking large amounts only once thirst appears. By the time you feel thirsty, you're already dehydrated. Your cells are already resistant. You're trying to catch up instead of staying ahead. These patterns are invisible. No one told you they mattered, but they do. And the difference between knowing this and not knowing it is the difference between stable blood sugar and spending the rest of your life thinking you're the problem. You're not the problem. Dehydration is. So, what's the solution? I call it the WTR Protocol. W for water quality, T for timing, R for regulation, and adaptation. Let's break it down step by step so you can implement this starting tomorrow morning. First, water quality. Filtered water is ideal. Tap water works, but filtered removes contaminants that can affect absorption. More importantly, minerals matter, especially magnesium, potassium, and sodium. Why? Because glucose transport is electrical. Insulin signals cells to open. That signal is electrical. Without minerals, the signal weakens. A simple trace mineral addition, a pinch of sea salt or a mineral drop improves cellular hydration dramatically. You don't need expensive products, just mineralized water. Now, timing. This is where most people get it wrong. It's not about how much you drink, it's about when. There are 4 hydration windows that stabilize blood sugar better than random drinking throughout the day. First window, immediately upon waking. Room temperature, 12 to 16 ounces. This rehydrates after the overnight fast, reduces cortisol-driven glucose release, and primes cells for insulin sensitivity. Your fasting glucose reading depends on this more than you realize. Second window, 30 minutes before meals. 8 to 12 ounces. This improves blood flow to the digestive system, slows carbohydrate absorption, and prevents post-meal spikes. You're preparing your body to handle food efficiently. Third window, mid-morning and mid-afternoon. 8 ounces each. This maintains circulation and prevents the gradual dehydration that causes afternoon blood sugar variability. Most people crash between 2 and 4 p.m. This is why. And fourth window, 2 to 3 hours after your last meal, 8 ounces. This supports overnight kidney function without disrupting sleep. Too close to bed and you'll be up all night. Too early and you're dehydrated by morning. Same water, different timing, different outcome. Here's why timing works. It improves blood flow. Hydrated blood is less viscous. It moves faster. It delivers insulin to cells more efficiently. It reduces cortisol-driven glucose release. Dehydration is a stressor. Stress hormones raise blood sugar. Hydration lowers stress response. It slows carbohydrate absorption. Water before meals dilutes stomach acid slightly and slows gastric emptying. This smooths out glucose curves. And it stabilizes fasting and post-meal readings. Consistent hydration creates consistent cellular response. Your body stops guessing. It knows what to expect. Now, I need to address something you're probably thinking. I'll urinate more. You will. At first, that's normal. That's your body recalibrating. For the first week, maybe 10 days, you'll visit the bathroom more often. That's not a problem. That's adaptation. This is the regulation phase. Within 10 to 14 days, your kidneys, bladder, and cells recalibrate. Blood sugar variability decreases. Mental clarity improves. Energy stabilizes. The inconvenience is temporary. The benefit is lasting. Your body is learning to hold onto water efficiently again. It's reactivating those aquaporin channels we talked about. It's training your kidneys to filter without wasting. Give it time. Trust the process. Let me walk you through what to expect week by week. Week 1, more bathroom trips, minor changes in readings, maybe a slight drop, maybe not. This is normal. Your body's adjusting. Week 2, less variability. Your fasting glucose starts to stabilize. Post-meal spikes become smaller. You'll notice the difference. Week 3, noticeable fasting glucose improvement. This is where most people see numbers drop into a better range. Mornings become predictable again. Week 4 and beyond. A1C improvement under medical supervision. This is when labs start reflecting what you've been feeling. Consistent hydration creates consistent results. Let me give you another example. Elaine, 75. Elaine's A1C climbed from 7.9 to 8.8 over 6 months. Her doctor was discussing insulin. She was panicking. She thought she was failing. When we assessed her hydration, she was severely dehydrated without realizing it, drinking maybe a glass of water a day. Everything else was diet, soda, and decaf coffee. We implemented structured hydration, minerals added, 4 windows, room temperature. 3 months later, her A1C dropped to 7.4. No new medications, no extreme diet, just restoring the environment her body needed to use the medication she was already taking. That's the power of getting the basics right. And if you're sitting there thinking, could it really be this simple? Yes, it can. It is. Your body isn't broken. It's just been working without the tools it needs. Now, let me show you the mistakes that derail most people in the first 2 weeks. Now, let me address some myths I hear constantly. Myth number 1: if I'm not thirsty, I don't need water. Wrong. Thirst is a late stage dehydration signal. By the time you feel thirsty after 60, you've been dehydrated for hours. Your blood sugar has already been affected. Myth number 2: drinking water with meals dilutes digestive enzymes and is bad for you. Not true. Water before meals is beneficial. Water during meals in moderate amounts is fine. Your stomach acid is strong enough to handle it. This myth has caused more harm than good. Myth number 3: you can get all your hydration from food. While fruits and vegetables contain water, it's not enough for optimal cellular function, especially as you age. You need plain water, period. And myth number 4: everyone needs 8 glasses a day. The amount varies by body size, activity level, medications, and climate. The 4-window structure is more important than hitting an arbitrary number. Focus on timing, not counting. Here's something that matters. In winter, people drink less water because they don't feel hot, but indoor heating dehydrates you significantly. Your home's furnace pulls moisture from the air, which pulls moisture from your body. Winter dehydration is real and often worse than summer dehydration because it's invisible. You're not sweating, so you don't think about it, but your blood sugar knows. I see more unstable readings in January and February than any other months. Not because of holiday eating, that's November and December, it's because of winter dehydration in the months after. So in winter, you actually need to be more intentional about hydration, not less. Summer brings different challenges. You're sweating more, losing electrolytes faster. This is when minerals become even more critical. A pinch of sea salt in your water isn't just helpful, it's necessary. Without it, you can drink water all day and still be dehydrated because you don't have the electrolytes to hold the water in your cells. It just passes through. I've seen people confused about why they're drinking constantly but still feeling dehydrated and seeing high blood sugar. It's the minerals. Always the minerals. Let me tell you about George, 73. George was doing everything right, eating well, exercising, taking medication, but his morning fasting numbers were consistently in the 150s. He was frustrated. We discovered he was drinking a full liter of water right before bed because he'd heard hydration was important, but he was waking up 3 times a night to urinate. His sleep was destroyed. Poor sleep was spiking his morning cortisol, which was spiking his fasting glucose. We moved that liter to throughout the day in the 4-window structure and reduced his evening water to just 8 ounces, 2 hours before bed. Within 10 days, he was sleeping through the night. Within 3 weeks, his fasting glucose dropped to the low 120 seconds. Same total water intake, completely different timing, completely different result. Here's what nobody tells you about blood sugar testing. The consistency of your readings matters more than occasional spikes. If your fasting glucose is 130 every single morning, that's actually better than bouncing between 90 and 180. Consistency means your body knows what to expect. It can adapt. Variability means constant stress and adjustment. Structured hydration creates consistency. Your body learns the pattern. Your cells expect the water. Your insulin response becomes predictable. This is why week 3 is when most people see dramatic improvements. The body has learned the new pattern. Now, let's talk about medication interactions. Some blood pressure medications are diuretics. They make you urinate more. If you're on these, you need even more intentional hydration. But here's the key. You need to space it properly. Don't drink a huge amount right after taking a diuretic. It just goes straight through. Instead, sip consistently throughout the day. Let your body absorb it gradually. And talk to your doctor. Some people on diuretics need their dose adjusted when they start hydrating properly because their blood pressure improves naturally. This happened with 3 of my patients. Better hydration, better blood pressure, lower medication needed, always done under medical supervision, but it happens. Here's a question I get often. What about coffee? I love my coffee. Can I still drink it? Yes. But understand what it does. Coffee is a diuretic. For every cup of coffee, you need an additional 8 ounces of water to compensate. So if you have 2 cups of coffee in the morning, that's 16 ounces of extra water you need beyond your regular hydration. And never count coffee toward your hydration windows. It's separate. Water is water, coffee is coffee. They serve different purposes in your body. Let me share something personal. Early in my career, I didn't pay much attention to hydration. It seemed too basic, too simple to matter. I focused on the complex stuff. Surgical techniques, medication protocols, advanced diagnostics. But over the years, I kept seeing the same pattern. Patients who hydrated well recovered faster from surgery. Their wounds healed better. Their blood pressure was more stable. Their blood sugar was easier to manage. It was undeniable. And I realized I'd been overlooking the foundation while focusing on the structure. Once I started teaching this to patients, the results spoke for themselves. I'm sharing this because I want you to know I learned this the same way you are, through observation, trial, and undeniable results. Now here's something about accountability that helps. Find someone to do this with you, a spouse, a friend, a sibling. Check in with each other. Did you do your morning water? How are your numbers? This isn't about pressure, it's about support. My most successful patients had partners who did this with them. Even if the partner didn't have diabetes, they benefited from better hydration too. Everyone wins. Now let me be very clear about something. This is not a cure. This is not a replacement for medical care. Never stop medication without your doctor. If you have heart failure, kidney disease, or take diuretics, speak with your physician first. Hydration can affect medication levels and fluid balance. You need supervision. Watch for overhydration signs, swelling in your ankles, sudden weight gain, headaches, nausea. These are rare if you follow the protocol, but they're possible. Adjust gently. Listen to your body. This is about supporting your treatment, not replacing it. Here's how to track your progress properly. Get a simple notebook, not an app, not a fancy system, a notebook. Each day, write the date, your 4 hydration windows with check marks, and your blood sugar readings. Morning fasting, 2 hours after breakfast, before bed. That's it. After 2 weeks, look at the pattern. You'll see the connection. You'll see how hydration days correlate with better readings. This visual proof keeps you motivated when discipline wavers. Let me tell you about the people who struggle with this. Usually it's not because the protocol doesn't work, it's because they overcomplicate it. They buy expensive alkaline water machines. They stress about the exact mineral ratios. They try to be perfect. Don't do this. Simple works. Filtered water or clean tap water works. A pinch of sea salt works. 4 times a day works. Perfect is the enemy of progress. Start simple. Stay consistent. Results follow. Here's a troubleshooting guide for common issues. If you're hydrating properly but still not seeing results after 3 weeks, check these things. 1. Are you actually drinking room temperature water or is it cold? Temperature matters. 2. Are you adding minerals or just drinking plain water? Minerals matter. 3. Are you timing it properly or just drinking randomly throughout the day? Timing matters. 4. Are you compensating for coffee and medications that dehydrate you? Compensation matters. And 5. Are you getting enough sleep? Sleep affects everything. If you're doing all 5 correctly and still not seeing results, then you need to look at other variables with your doctor. Here's what happens long term when you maintain this. Your body becomes more resilient. You can handle stress better. You can handle occasional indulgences better. You can handle schedule disruptions better because your foundation is solid. I've had patients tell me they can now have birthday cake at family gatherings without their blood sugar spiking dangerously because their baseline hydration keeps their cells responsive. That's freedom. That's what this gives you. Not perfection, but resilience. And let's talk about what this means for your family. When your kids or grandkids see you taking control, implementing something this simple, and seeing results, you're teaching them. You're showing them that health doesn't have to be complicated, that small, consistent actions matter, that bodies respond when we give them what they need. You're modeling healthy aging, and that's a gift beyond blood sugar control. That's legacy. Here's my final challenge. Don't just try this for 2 weeks. Commit to 90 days. That's how long it takes for real cellular adaptation. That's how long it takes to see A1C changes. That's how long it takes to truly know if this works for your body. 90 days of 4 hydration windows. 90 days of minerals. 90 days of room temperature water. 90 days of tracking. If after 90 days you see no improvement, then we reassess. But I've never seen someone do this correctly for 90 days without measurable improvement. Never. So let's talk about implementation. How do you actually do this? Start with 1 hydration window this week. Just 1. Pick the easiest one. For most people, that's waking up. Set a glass of room temperature water on your nightstand tonight. Drink it first thing tomorrow. Do that for 3 days. Then add the before meal window. 30 minutes before lunch. Do that for 3 days. Then mid-morning, then mid-afternoon, then evening. Build slowly. Let your body adapt. Don't try to do everything at once. This isn't a race. It's a recalibration. By week 2, you should notice something interesting. Not just blood sugar changes, energy changes. Most people report feeling more alert in the afternoons, less brain fog, better mood. This isn't placebo. This is your brain getting consistent hydration for the first time in years. Your brain is 73% water. When you're even slightly dehydrated, cognitive function drops, decision-making weakens, mood darkens, and you had no idea it was connected. Now let's talk about travel. This is where most people fall off. Airports, hotels, different schedules. It's easy to forget the structure. Here's what works. Bring an empty water bottle through security. Fill it immediately. That's your morning window. Handled before your flight even boards. On the plane, ask for water every time the cart comes by. Airplane cabins are incredibly dehydrating. The air humidity is lower than most deserts. At hotels, fill the coffee maker carafe with water the night before. Set it on the nightstand. Your morning window is ready when you wake up. Traveling doesn't break the protocol. It just requires 30 seconds of planning. Restaurants are another challenge. When you sit down, immediately ask for water. Room temperature if possible, but any water is better than none. Drink it before you order. This hits your before meal window perfectly. Most restaurants will refill without you asking if the glass is empty. Here's something about seasonal patterns. In summer, you'll naturally want more water. That's good. Listen to that. Add an extra 8 ounces in hot weather. In winter, set reminders. Your body won't signal thirst as strongly, but your needs haven't decreased. Heated indoor air pulls moisture from your skin and lungs constantly. If you live in a dry climate, Arizona, Nevada, Colorado, you need 15 to 20% more water than someone in a humid climate. Your body is working harder to maintain moisture. Now let's address cost, because I know some of you are thinking about it. Filtered water from a pitcher costs pennies per gallon. Sea salt costs $3 and lasts 6 months. That's it. You don't need alkaline water at $8 per bottle. You don't need special mineral drops at $40 per container. You don't need anything expensive. Simple works. Affordable works. Sustainable works. Here's what you actually need to start. A reusable water bottle, a container of sea salt, a notebook, and commitment. That's under $20 total if you don't already have these things. Compare that to the cost of escalating medications, doctor visits, emergency room trips from uncontrolled blood sugar. Compare that to the cost of complications down the road. This is the cheapest intervention with the highest return I've ever seen. Here's one more real example. Patricia, 68. Patricia traveled constantly for her grandkids, different cities every month. Her blood sugar was chaos. We built her a travel kit, small water bottle, miniature salt container, printed hydration schedule on a card in her wallet. She followed the four windows no matter where she was. 3 months later, her A1C dropped from 8.6 to 7.2. Same travel schedule, same stress, different hydration approach. The protocol adapts to your life. You don't have to adapt your life to the protocol. That's the beauty of it. It's flexible enough to work anywhere while being structured enough to create results. Now let me show you something most doctors never explain about medication timing and hydration. When you take metformin, the most common diabetes medication, it works better when you're properly hydrated. Metformin reduces glucose production in your liver and improves insulin sensitivity in your muscles. But both of those processes require adequate blood volume and circulation. Dehydration reduces blood flow. Reduced blood flow means metformin can't reach tissues as effectively. You're taking the medication, but it's not getting where it needs to go. This is why some people need higher doses over time. Not because the medication stopped working, but because their hydration declined and nobody connected the dots. The same applies to sulfonylureas, SGLT2 inhibitors, and insulin itself. All of them work better in a hydrated body. All of them struggle in a dehydrated one. Your doctor prescribed the right medication, but if you're dehydrated, you're fighting the medication instead of supporting it. Here's something critical about the dawn phenomenon. That's when your blood sugar spikes in the early morning hours before you wake up, even though you haven't eaten anything. It happens because your liver releases glucose to prepare your body for waking. It's supposed to happen, but in people with diabetes, it releases too much. Dehydration makes this worse. When you're dehydrated overnight, your body interprets that as stress. Stress triggers cortisol. Cortisol tells your liver to dump even more glucose into your bloodstream. That's why your fasting reading is high, even though you did everything right the day before. The morning hydration window interrupts this cycle. Water first thing reduces cortisol, signals safety to your body, and helps clear that excess glucose faster. I've seen fasting numbers drop 20 to 30 points just from consistent morning hydration. Nothing else changed, just that one window every single day. Let's talk about sleep, because it's directly connected. Poor sleep raises blood sugar. We know this, but dehydration causes poor sleep in ways you don't realize. When you're dehydrated, your body produces more histamine. Histamine disrupts sleep architecture. You wake up more often. You get less deep sleep. Less deep sleep means higher morning cortisol. Higher cortisol means higher blood sugar. It's a vicious cycle. And hydration breaks it. Here's what happens in prediabetes. Your cells are starting to resist insulin, but your pancreas can still compensate by making more. You're on the edge. You could go either way. In this stage, hydration makes an enormous difference. Proper hydration can actually reverse prediabetes in many cases because you're restoring insulin sensitivity at the cellular level before permanent damage occurs. I've seen A1C numbers drop from 6.2 to 5.4 with structured hydration alone. No medication, just fixing the foundation. But here's the hard truth. Once you're in full type 2 diabetes, hydration won't reverse it completely, but it will stabilize it. It will reduce your medication needs. It will prevent progression. It will improve your quality of life dramatically. That's not a small thing. That's everything. The difference between stable diabetes and declining diabetes is the difference between independence and complications, between living fully and living limited. Hydration doesn't cure diabetes, but it changes the trajectory completely. And if you're sitting there thinking you've already progressed too far, that it's too late, you're wrong. It's never too late to stabilize. It's never too late to improve. It's never too late to give your body what it needs to function better. Your cells are still there. They're still capable. They just need the right environment. Let me paint you a picture of what happens after 6 months of doing this consistently. Your morning routine becomes automatic. You don't think about it anymore. The water is just there. You drink it. Your body expects it. Your cells are ready for it. Your blood sugar becomes predictable. Not perfect, but predictable. You know what to expect. Your doctor notices. Your labs reflect it. Your medication might get adjusted downward. But here's what really changes: the things nobody tells you to expect. Your skin looks better. Hydrated skin has elasticity. It heals faster. Those small cuts and scrapes that used to take weeks now take days. Your joints feel better. Cartilage is 80% water. When you're chronically dehydrated, your joints grind. When you're hydrated, they glide. Less pain, better mobility. Your digestion improves. Constipation that you thought was just part of aging, often it's dehydration. Proper hydration normalizes bowel function naturally. Your blood pressure stabilizes. Dehydration thickens blood. Thick blood is harder to pump. Your heart works harder. Hydration reduces that load. Many of my patients have reduced their blood pressure medication under medical supervision. Your kidney function improves. Your kidneys need water to filter waste. When you're dehydrated, they struggle. Proper hydration protects kidney function. And protecting your kidneys when you have diabetes is absolutely critical. These aren't side effects. These are your body working the way it's supposed to when you give it what it needs. After a year, something deeper shifts. You start to trust your body again. For so long, you felt betrayed by it. Your body wasn't doing what it should. Your blood sugar wouldn't cooperate. You felt broken. But now you realize you weren't broken. You were just missing a piece. And once you added it back, everything started working better. That trust changes everything. You stop feeling like a victim of your diagnosis. You start feeling like a participant in your health. You make better decisions because you've seen what small, consistent actions can do. You believe in your ability to influence outcomes. That belief is powerful. It extends beyond blood sugar. It touches every part of your life. Think about your future for a moment. Really think about it. Do you want to spend the next 10 years watching your health decline, adding medications, losing independence, worried about complications? Or do you want to spend it stabilized, functional, present for your family, doing the things you enjoy? That choice is being made right now, not 10 years from now, right now. Because the trajectory you're on doesn't change by itself. It changes when you change the inputs. Hydration is an input, a foundational one, and you control it completely. Nobody can do this for you. No medication can replace it. No supplement can substitute it. This is yours to implement or ignore. I'm giving you information. You decide what to do with it. Here's what I know. The people who implement this consistently see results. The people who dismiss it as too simple stay stuck. Complexity isn't always better. Sometimes the most powerful interventions are the simplest ones. Your body is waiting. Your cells are ready. The question is, are you? Let me show you exactly how to start and what the next 90 days should look like. Here's your 90-day commitment, starting tomorrow morning. Before you go to bed tonight, fill a glass with room temperature water. Put it on your nightstand. Add a small pinch of sea salt if you have it. If not, plain water works. Tomorrow morning, before coffee, before checking your phone, before anything else, drink that entire glass. That's day 1, window 1. Do that every single morning for 7 days. Just that one window. Build the habit before adding complexity. On day 8, add the before meal window. 30 minutes before lunch, drink 8 to 12 ounces of room temperature water. Do both windows morning and before lunch for another 7 days. On day 15, add mid-morning and mid-afternoon, 8 ounces each. Now, you're doing 4 windows daily. On day 22, add the evening window, 2 to 3 hours after dinner, 8 ounces. By day 30, all 5 windows are automatic. Your body knows the rhythm. Your cells expect it. From day 30 to day 90, you maintain, you track, you watch your blood sugar patterns stabilize, you watch your fasting numbers improve, you feel the difference. On day 90, you check your A1C with your doctor. You compare it to where you started. You see the proof. Get a simple notebook today, not tomorrow, today. Write day 1 on the first page and tomorrow's date. Each day, check off your hydration windows, write your blood sugar readings, 3 numbers, morning fasting, 2 hours after breakfast, before bed. That's it. Nothing complicated, just consistent tracking so you can see your progress. Here's what will try to stop you: doubt, impatience, distraction. You'll miss a day and think you failed. You haven't. Just start again the next morning. You'll test on day 5 and see no change and think it's not working. It is. Your cells are adapting. Give it time. You'll get busy and forget. Set alarms. Put sticky notes on your bathroom mirror. Make it impossible to forget. The people who succeed aren't more disciplined than you. They just have better systems. Build the system. Follow the system. The results follow the system. Now here's my challenge to you. Don't just watch this and move on. Don't just think that's interesting and forget about it by tomorrow. Prove me wrong. Actually do this for 90 days and see what happens. If I'm wrong, you've lost nothing. You've drunk some water. Big deal. But if I'm right, you've changed your trajectory. You've stabilized your blood sugar. You've reduced your risk of complications. You've given yourself years of better health. The risk-reward ratio here is absurdly in your favor. So what's stopping you? Really, what's stopping you? It's not money. It's not time. It's not complexity. It's belief. You don't quite believe something this simple could matter this much. I'm telling you it does. My patient's lab results tell you it does. The science tells you it does. But you won't know until you try it yourself. 90 days. Starting tomorrow. 1 glass of water at a time. Your body is ready. Your cells are waiting. The only question left is whether you're willing to give them what they need. I think you are. Now go fill that glass and put it on your nightstand. Tomorrow morning, we begin.